Today we will look at schizophrenia, what it is, how to identify it, and how to get help from this mental illness. Hi, my name's Travis, and welcome to our continuing series of mental health and well-being topics this month. Let's get right into it. Over 100 years ago, schizophrenia was first identified, and still today we are unclear of its exact causes. It still today remains one of the most understood and stigmatized mental illnesses today. So let's look at what we know about the symptoms, causes, and treatments. Schizophrenia is actually considered a syndrome, which means it may include a number of disorders that have similar symptoms and causes. Every person usually will have slightly different symptoms, and the initial symptoms can be very easy to overlook, like changes in irritability, personality changes, or having these gradually intrusions of unusual thoughts. People are usually diagnosed after some onset of a psychotic episode, which occurs in late teens and early adults for men, and late 20s to early 30s for women. The first episodes, we have delusions, hallucinations, confused speech, and these are called positive symptoms. They happen to people with schizophrenia, but not generally in the normal population of people. Most people think that people with schizophrenia have multiple personalities, but these symptoms indicate a disturbed thought process and not multiple personalities. Schizophrenia also has negative symptoms like reduced motivation, expression, or emotions of speech. The cognitive symptoms are difficulty concentrating, making decisions, or remembering information. Schizophrenia has the strongest genetic link of any psychiatric illness. Although 1% of our population has schizophrenia, children are 10 times likely to get schizophrenia if their parents had it. And if someone has a twin and one twin has it, the other twin is 40% likely later on down the line to develop schizophrenia. That's how genetic it is. The antipsychotic drugs used to treat schizophrenia have helped researchers work backwards to trace signature of the disorder in the brain. Traditional antipsychotics block dopamine receptors. They can help reduce positive symptoms, but they can make the negative symptoms even worse. Newer antipsychotic meds are addressing some of these issues, targeting multiple transmitters like serotonin and dopamine. In spite of these complications, antipsychotic meds can be effective when combining other interventions like cognitive behavioral therapy and ECT, which is electrical shock therapy. ECT provides a short-lived relief, but recently it started emerging once again as an effective treatment, especially when other options have failed. Early intervention is really important, people. That's why education for patients, for their families, and other communities help erode the stigma and improves access to treatment. There's help out here, people. If you think that you have schizophrenia, or if you know someone who does, there is help out here. You can go on the internet and you can look up schizophrenia, and you can look up centers, you can look up antipsychotic meds, you can look up psychiatrists that treat these kind of disorders. Please get help if you need it.